I think being able to really tell a story with the data, insight and information that we're managing and been discussing is so key. And we forget that ultimately as humans, we're highly visual creatures. We like stories. We like things that have a start, a middle and an end. And data really is no different. So being able to use visualization and storytelling to present data and insights in an accessible way, whether that's charts, graphs, infographics, other visual pictures or metaphors, I think is a hugely powerful way of bringing this to life. Data scientists who are far smarter than I can sit and come up with some incredible conclusions. But for someone like myself, I need to understand how we got there and what that journey looked like and what the different decision points along that journey meant and why. I think that also then comes back to having an overarching, clear communication strategy for data, particularly if it's being used to make decisions. So knowing at the outset what that communication plan should look like, what the intention is, who the target audience is, how they want to be communicated with, across what channels they want to be communicated with, and tailoring it appropriately is really key. That's certainly true within companies. And Andy, I imagine it's equally, if not more so true when you're dealing with the population as a whole.
Yes, Esther, and to be fair, I think you've hit the nail on the head there. This idea of creating a narrative. I've heard the term data journalism before, and it's this kind of wonderful way of telling a story. And I think you've covered nearly all of the points there. But one thing I'd love to add is around decision analytics. It's this idea that often when we're making decisions, especially when we've got places with finite resources, people are competing for those resources. They're competing to the outcomes of those decisions. And sometimes you might have to turn something off to be able to do more. So you have to do less of something to pay for the other thing you want to add. There's very rarely just extra additional money thrown into the system. And so working together on creating a system agreeing or deciding how to make the decisions is really key. So I think that you will start to see much more decision analytics going forwards to help systems make complex decisions, agreeing what the problem is, going to your point, Esther, and then agreeing what are the variables, the factors that make a difference in that decision, and then measuring those objectively, and then being able to decide from those outcomes what we should do. So all of the narrative stuff that you talked about, which is absolutely key. And then I think we'll see a big movement in the future towards decision analytics.
I'm seeing the same in industry. I think this concept of how we make decisions and how we make different types of decisions and how we involve the right people at the right time is a key part of that overall communication and decision-making strategy. I guess one final thought on that is also making sure that we challenge ourselves on it regularly. So having the right feedback loops to look at when we're doing this well and when we're doing it not so well, and being able to regroup and revisit. We're dealing in such tumultuous times in terms of so many different factors on the global stage that nothing stays still. So being able to constantly challenge the way that we're using data and information and the way that we're coming together to make decisions, I think is so key. Thinking through some examples of where clear communication strategies around decision making have been helpful, I can certainly think of some from an industry context and from a life science company perspective, where actually bringing cross-functional teams together, for example, in the early stages of drug development, to think about the different parts of a patient journey that will be impacted by decisions taken through development is so key. So whereas when I first started in industry 25 years ago, the major decision point was what do we need to be able to have an approvable medicine in a country? So what does it take to meet the requirements of the regulatory agency, for example? Now that narrative looks and feels very different. We now need to think about what do we need, of course, to demonstrate that a treatment is safe and effective. We also need to think really deeply around what do we need to be able to demonstrate that a treatment or medicine adds value and actually is valued in the context of constrained healthcare resources, which means we're thinking about health economics and value and the considerations that payers perhaps will bring right back at proof of concept. So not waiting until an afterthought at phase 3. So that story of meeting stakeholders' needs early and planning decisions with the multiple lenses in mind, I think perhaps is one good example. Andy, how about from your perspective?
I think one of the great examples we've got is some recent work we've been doing on multi-criteria decision analysis. that uses STAR, which is the Socio-Technical Allocation of Resources, which is a tool created by LSE and funded by the Health Foundation. And what it does is it builds both of these elements together. There's a very visual outcome where we look at the costs and the value of individual interventions along a whole care pathway. And that's everything from the first 1,000 days all the way through to end of life care. And we're looking at things that address those wider determinants of health. So what we've got in the room, you have patients, carers, people with lived experience, people from the population, but then you also have local authority, education, environment, public health, primary care, secondary care, system leaders, all these people working together, deciding what they and their communities value. And then these are visually shown as triangles, these value triangles. And then they can start to look at this, the interventions which cost a lot of money, but don't deliver a lot of value, and then see where they may want to reallocate those resources. And through those different criteria, they can make a decision that helps address some of the vested interests that, of course, people don't want to give away what's theirs. And it comes back to your point around trust again, Esther, about trusting others to do the work. And finally, it means that you get to kind of see how you can shift money towards prevention and to interventions that the community and the public would want the most. So, and again, that's worked. We've done the work in 5 ICSs on COPD this year, last financial year, and then this year we're looking at mental health. So again, you can look at big meaty problems here to be able to kind of come up with good decisions.
I guess being able to communicate these examples clearly and effectively is also so key. So whether that's in the context of a life science company where we're demonstrating best practice in a particular space and being able to share the impact that that's had ultimately on the ability for patients to access a new technology, or whether in the context of the NHS. How do you think about communications in the context of the work that you do?
Well, I think that's a huge part of us. We're not an academic organisation, but we love to publish our work where available to make sure it's publicly available. So again, people aren't repeating the same bit of analysis, and to make sure it's out there. We do a lot of work when we're working with systems to make sure that we're sharing the results across that system and we're appropriate with the public and beyond. But of course, you can't possibly do this without an awesome comms team. And so I'm blessed to have a fantastic comms team who help us with social media and beyond. But as you say, it's telling a story. It's making sure that those things are pertinent going forwards.
And it's the same in consultancy, honestly. When we're working on complex decision problems, making sure that we've got really fabulous communicators working alongside us to translate it into what it means, what we learn and what we do differently next time. And that's not necessarily always an easy step for those of us who look with a more technical lens.